Hello, welcome to the Holistic Healer Podcast, a podcast dedicated to all things holistic. I am your host, Cheryl Lee. Today's guest is Dr. Nathan Riley, who is a board-certified OB-GYN. He is a hospice and palliative care physician who practices a holistic approach to birth, death, and everything in between. Today we sit down to discuss Dr. Riley's journey into holistic health, laying down the foundations of a healthy pregnancy for both men and women, birth control, hormone therapy, doing the emotional work, ancestral healing, and so much more. Enjoy the show. Hello, everyone. Welcome to the Holistic Healer Podcast. I'm your host, Cheryl Lee. And today I have Dr. Nathan Riley. He is a board-certified OB-GYN. He's also a hospice and palliative care physician who practices a holistic approach to birth, death, and everything in between. He also has a podcast called the Holistic OBGYN and offers two courses, one being the Bornfree method, a 12-week mastermind for soon-to-be parents who want to feel empowered, confident, and informed about the pregnancy and childbirth journey, as well as Free and Clear, which offers radical freedom for women and their partners to clear HPV the natural way through lifestyle coaching. So thank you so much for joining me today.
My pleasure. It's
yeah.
good to be here.
Yeah, for sure. So I came across you because I've been over a few times with Paul Chek for his workshops. And I know that you also promote biooptimizers with Wade, who's a mutual friend as well. So I'm super excited to have you on. I'd like to kind of start my interview with giving my guests a little bit of a journey as to what brought you to this place of holistic health and specifically in the field of obstetrics and gynecology for you.
I think anytime that we're going to embark on our own healing journey or an educational program, I think we have to be willing to just acknowledge when we've hit like a dead end. And for me, that dead end came very early in my residency training. And for those who don't know, medical school is 4 years. Residency is 3 to 7 years, depending on what specialty you're in. And then you can go fellowship, which is more post-grad training. And then eventually you emerge and you're expected to put this skill set to, into practice.
Right.
But frankly, my skill set wasn't really working for a lot of people. I was really, really good at surgery. I was really, really good at all of the things you're trained to do, but it wasn't really serving a lot of women. So if a woman were to come to me and say, hey, I want to have a home birth, despite spending $500,000, on my education and 10 plus years in training and doing all that, I wouldn't have been able to help her. Right. And with what's been going on in the world, and people becoming a little bit more discerning as to where they want to get their care.
Right.
Frankly, a lot of doctors, I think, feel compelled to push more medicine, more pharmaceuticals and technologies in the hospital system because that's the only thing they have.
Right.
So for me, I was like, well, listen, I have all of that. Like that's actually become very easy for me. What if I broadened my toolkit in order to be able to help a lot of people who are not hell-bent on vaccines and pharmaceuticals and hormones and or what we call hormones, but like
yes,
endocrine disrupting chemicals like birth control. What if they don't want those things? Then I'm just useless.
Yeah, right.
So I just needed something more. I wanted to have more tools to offer people. And I think when people hear that I'm like a holistic doctor, they're like, he's a quack and this and that. Like, no, guys, I'm like as board certified as anybody. Yeah. I've done all of those things and I choose not to use those 99% of the time.
Right.
And my clients are grateful. So.
Well, I think also too, like I have 3 children and 2 were born at home. And I know that.
Good for you.
Yeah, it was amazing. It was some years ago now, but even at the time, there was a push for in the hospital setting, the difference between being at home and being in the hospital setting was just, it was absolutely like night and day, just as far as the pressure too, like after the child's born and them taking the baby away and, kind of pushing all of the vaccines and everything that they need. It's like, it puts a lot of pressure on the woman in that moment and almost feeling like a sense of obligation almost, rather than just being in the moment and connecting with that precious moment that you're never going to experience again, not with that child. So
Yeah.
how would you
Yeah.
encapsulate or summarize your mission?
My mission is very, very simple.
Mm-hmm.
It's to put women or their families or whoever my client is at the center of their care.
Yeah.
That's it. And that sounds super easy and like, no, duh, doctors do that. No, we don't do that.
Yeah.
We were never trained to do that. We were never trained to say, hey, what's important to you, and spend time getting to know you.
Yeah.
And that might be hours, days, weeks, months of your pregnancy. And then once I understand who you are, it's very easy for me to take this broad skill set and put you at the center and say, okay, Shirley, here's your goals. Here's what you're not willing to risk. Here's what you are willing to risk. You have a team now around you.
Yeah.
You just tell us how to serve you so that you can go in and do that inner work from the standpoint of childbirth, let's say.
Yes.
You can do that thing.
Mm-hmm.
Right? But you could say the same about endometriosis, abnormal pap smears, and this cervical dysplasia thing that people are grappling with. I mean, you could say that about every women's health issue. Women have never been at the center of the conversation.
Yes.
They've been at the outside trying to get some support. And I don't really feel like OB-GYNs are trained to do that. Like, you don't get the patient-centered experience because that's not what they were trained to do.
Right.
So you don't go there expecting that. And so I think a lot of women now are really trying to put themselves in the center and trying to find people that are willing to keep them in the center. And so that's my mission, is to support midwives, doulas, other birth workers, other practitioners who are really dedicated to that mission.
Do you find that when you're working with a woman who is not used to being kind of at the center, that sometimes it is a bit of a reinforcement through the journey to allow her to be in that place and not look outside of herself for guidance, for example, to what she really wants?
Yeah.
Or how's your experience with something like that?
Well, I've got a sister, no other siblings. I've got a wife. My wife and I met when we were 15.
Wow.
We've got
amazing.
2 little girls. We even have a female dog. Like,
Uh-huh.
I am surrounded by women
Yeah.
in my practice, in my personal life, in my world. And I can't tell you the number of times where, like, we kind of get into this like casual conversation around the sort of appeasing of men that women have to do in order to survive in the world,
Mhm.
right? There's this, I just had a great conversation with Ayla Cuenca, who's this doula and really a trauma-informed doula that helps people not just through birth, but also pregnancy loss. And we were riffing on this reality for so many women. And I've gotten into this with Hermine Hayes Klein, who's an attorney who specializes in human rights and childbirth, and a variety of other people who have come my way. And they're surprised that they're actually being given the decision. Like the Bradley method of birthing, really what was special about that, with this very Christian, very faith-based OB-GYN, he saw a value to having men in the room, because men are not used to being gaslit or pushed to the outside, waiting for whatever crumbs fall to them.
Right.
Women have had that experience. So, I mean, how many women have had sex with somebody just because they didn't want to say no because they were afraid for their life? Like, I mean, not to mention they have pushed back and then they've been raped. Like, this type of stuff is just as deeply rooted in the conventional medical model, where I can touch you and do whatever I want to you because you're here. And if you didn't want me to do that, why did you come here? It's almost like, how dare you even have any sort of preference here?
Exactly.
So this self-betrayal, right, where you're just saying yes to things because because you think if you say no and give a little pushback, you're not going to be supported, you're not going to be given attention in the hospital or even in your intimate relationships. This is a deep part of a woman's experience usually, and for them to be expected now to say, hell no, I'm not letting you do that to me, when they're in the throes of labor, is crazy. Of course they're going to go along with it. And then you're going to say they gave me consent. Well, they didn't really give you consent. They're just trying to protect their sanity and their lives. So it's, I think, very confronting for a lot of women.
Because I would imagine too, there's a fear that takes place that if they were to give any type of a pushback or kind of not being that people pleaser, that somehow, not only they won't be looked after, but potentially their child to be, they're not going to get the attention that they want during their birthing process, or, they're going to be. So, I mean, there's a lot of the psychology that goes into that is huge. I imagine over the years, because you've stepped outside of what the norm is for medicine in the way that you practice, How have you handled criticism over the years, and how has that evolved from the beginning when you first kind of started on this path to now?
It's probably no surprise to people that I don't have a lot of friends in the
Yeah.
conventional medical model.
Yeah.
And it's not to say that I don't like them. I see a purpose for us to have hospitals. Some of my best friends are ER and
Sure.
ICU physicians. Like,
Yeah.
they're saving lives.
Hmm.
Some of my good friends are OB-GYNs. They see me as a little bit of a heretic, but so be it.
Yeah.
The criticism for me started in medical school when I was giving some pushback around the GI lectures around gluten intolerance and whatnot, because I knew there was something to that, even though I
Right.
was just a young, dumb medical student. But, it was like, hey, why do you have to push back all the time? Why are you like always asking questions that don't have
Hmm.
answers? And it's like, because that's science. Like, that's what I signed up to do. But then even in residency, within the first couple months, my program director said, you seem distracted. Your family needs to know that they come second now. And like, then none of that ever jived with me.
Yeah.
But then as I got more experience doing birth work in the hospitals, I started taking my foot off the gas and doing less exams,
Mm-hmm.
sitting down and having more conversation without doing any interventions. Like, take off the white coat, put on a sweater, and just go and get to meet these people who are going to go through this.
Yeah.
And even that was criticized. So now fast forward, I'm on social media and whatnot. I've gotten knocked around, like,
I can.
some really nasty, vicious stuff, because I'm not a feminist, because I think we need to do a better job of counseling young women around the downsides of hormonal contraception,
Yeah.
or having a home birth ourselves at home. Like,
Hmm.
who the hell is this guy? Like,
Yeah.
what is he doing? And I support midwives in almost every state now. So it's like, I am not doing what most people trained me or expected me to do.
Yeah.
And I think deep down, Shirley, I think they actually kind of wish they had the not just incentives, but they had the space to explore some of these things. Because I think deep down they actually would want that for
Yes.
themselves. But here they find themselves with $500,000 in debt, and they don't want to disappoint their colleagues.
Yes.
They're the young faculty member. They have all these other pressures that are forcing them
Yeah.
and compelling them to keep doing this thing. So when I'm like, hey guys, I stepped out and I'm having a great time. I played
Yeah.
pickleball this morning instead of going to clinic. They're like get them, and so
Yeah.
I have to hold space for them. I have a lot of compassion for people in the hospital systems, but it wasn't for me, and it never will again be for me.
Yeah. So really for you then, I guess the criticism has maybe like been a little bit of a driver, would you say, as well? Just to kind of keep, oftentimes, it said like if whatever it said, what you should do, do the opposite. And that's usually the right thing, whatever that
Yeah,
happens
I
to
mean,
be, right?
yeah, I don't think if you aren't pissing off a part of the population,
Yes.
you're kind of wasting your time. Now, what I have done in the past is I've responded in very nasty ways. An example is I posted a thing about birth control, as I mentioned, and an OB-GYN with a ton of followers on TikTok, they were like, oh, another claim without any evidence. And I was like, you want evidence? Here's the evidence. And by the way, while you're in the OB lounge snarfing carbs, I'm over here reading literature.
Yes.
They always say, Shirley, there's a joke. The joke is, if you want to hide something from an OB-GYN, what do? You publish it.
Oh God.
And it's because
Okay.
we don't have the time to read. And I get it. Like, you're
Yeah.
tired, you're on call, and there's lots of like treats around. So you're on your phone shopping on Amazon, you and all of the other
Yeah.
labor and delivery nurses and all that. That's how you spend your time. Me, I'm in the gym, I'm meditating, I'm doing yoga, I'm playing with my girls, and
Yeah.
I'm reading and reading and reading.
Yeah.
So I snapped back in that nasty way, and it was taken as like fat phobic and all this. And it was like, God, I have to just get out of that. Like, I can't be responding like that, because everybody has their own story. Everybody's going to
Yes.
interpret this stuff differently.
Yeah.
And they might be on birth control and they might be happy. That's fine. But that's not what 90% of the people coming to me are all about. So I had to get off certain platforms and really refocus, like, how do I
Yeah.
really want to show up here? Which is trying to show love and compassion for
For
everybody. And I've
everyone.
slipped just like every other human
Of
being on the planet.
course, of
So
course. Well, I mean, the non-judgmental piece is kind of like always a work in progress because, to remember that, everyone's on their own journey and they all,
yeah,
have their own lessons to be learned through their own specific experiences. But when we're
yeah,
in a position where we see it as like, look, this isn't working for them, we have the answers. It's very hard sometimes just to be able to take a back seat and not say something, and then that of course can be taken the wrong way. And so I think yeah, that's an absolute, it's a
Yeah.
work in progress for sure. You
It's
know?
it's a it's definitely a work in progress, and, I will not budge from my continued advocacy. I just have
Yeah.
to be a little bit more gentle about it because we've got a lot of very sick doctors that are giving people healthcare advice
I
or
know.
lifestyle advice,
It's
and they have absolutely no clue what is going on within their systems because they were never taught like that. That's not what medical school teaches you.
right.
It teaches you how to take care of sick people,
Yes.
and hospitals are for sick people, not for healthy people. So if you want to get healthy, don't go to the doctor who's smoking outside of the dialysis
Yes.
clinic or eating a bunch of junk from the hospital cafeterias, which are laden with seed oils and Coca-Cola and sugar and all this other stuff. Like,
Yeah.
they are not the pinnacles of health, which is a shame.
Yeah.
Like, if they were, then they have a little more credibility, but we're losing faith in these institutions, partly because these institutions are being operated by people who don't even know a lick about how to take care of themselves. And you're going to take advice from them. Like,
Yes.
it's not their fault. And it's also kind of on you to start being a little bit more discerning as a consumer. Like, do you want to
Absolutely.
get better or do you want to perpetuate this?
Yeah, and I think that piece is so important to, you have to take responsibility for your own health, and you have to take responsibility for the providers that you're choosing to be
Right.
part of your life. To, if you're going to put the onus on that person to help guide you, then it's up to you to do the homework on that person and find out about them. I mean, we live in a world now where you can get pretty much information about everyone, about anything. So I think it's definitely, for sure, we can get really terrible advice from a lot of healthcare
Yeah.
providers, but then on the other side of that, it is up to the person who's having that person in their life to guide them on their health journey. So
Yeah. Yeah.
so I wanted to kind of maybe talk a little bit about laying down the foundations of not only a healthy birth, but a healthy conception. So prior to, if a couple wants to get pregnant, but they really should be thinking about their health and their holistic health prior to that moment. I'm assuming you would agree with that. And so
Yeah.
some of the obvious ones are, eating whole foods, getting enough water, getting enough sleep, getting fresh air, looking after our emotional health. But I think even now, some of the less obvious ones for some are, for example, with women. I kind of wanted to do both men and women. And one is
Sure.
the birth control, through the birth control pill, IUDs, the shot. I'm not sure. Are they still doing that shot where you get a shot in the arm and it? Yeah.
Yeah, yeah, yeah. We used to do. Not too many people use that method, but it is like if you're into shots, you get a shot, and you don't have to worry about it for a little
Yeah.
while.
Yeah.
Yeah,
So
yeah,
what are the potential effects of this? Because a lot of like adolescent girls are getting on the pill far earlier now, I think, than ever before. I mean, I think some 12-year-old girls are on birth control pills. And what is going to be the long-term effect of that in terms of conceiving and having a
mm.
healthy pregnancy?
Yeah. I hate to bring other names into this space, but there's a lot of people out there that are speaking out of their lane on this
Hmm.
topic. I'll just say it. Like, there's a great podcast, Andrew Huberman. He's a neuroscientist, Stanford,
Yeah.
really probably great person, probably very well researched. But he did an episode where he had like I guess it was like a hormone expert, some
Uh-huh.
other guy
Hmm.
who has not prescribed birth control, has not taken care of people as they're trying to get pregnant after the maybe 5-10 years of birth control. And the data, the research, here's where like evidence-based medicine gets us kind of in
Yeah.
a pickle. The evidence shows that most women who are on birth control have no problem getting pregnant. There's no statistically significant difference between whether you're on birth control or not, or if you're on birth control and you come off, that you would have any issues getting pregnant. But that's simply not the case.
Right.
And the longer you're on it, the higher the dose that you're on it, whatever other crap is going on in your life, the chronic stress. I'm like a straight white male who came from a very Christian upbringing. I'm
Uh-huh.
not necessarily Christian now, but it's like I had all of the privilege cards lined up. And if I had been on a synthetic endocrine disruptor, let's call it what it
Yeah.
is, it's not hormones. These aren't hormones.
Yeah.
These are substances named to look like hormones, but they're not hormones.
Mhm.
you ingest these for a while, and you add to that all the glyphosate, laden foods, like
Yeah.
the junk being dumped into our soil, air, water, the EMF towers going up everywhere, and then add to that like the information overload and our lack of being open and vulnerable as men. And I would also have issues with fertility, but we are not giving men birth control. Instead, men have all these other things
Yeah.
that that we most Americans are sort of adding to the system, these allostatic stressors.
Yeah.
So
Yeah.
for a woman, for a young woman, like first off, in those first couple of years, that when you get your menarche, as we say, your first period, it's going to take time for your brain, your thyroid, your adrenals, and your gonads to figure this whole thing out.
Yeah.
But instead of letting it figure itself out in restitude, in a natural 13 cycles per year rhythm, which is very much in alignment with what we see in nature, instead we're saying, hey, that period is so pesky, let's just squash your ovaries altogether, and when you're ready, come off birth control.
Yeah.
And then we look at a couple studies looking at a generalized
Yeah.
population of people, and we say it's not going to harm your
Mm.
fertility. Well, it's bullshit. Like,
Yes.
I'm seeing it every single day.
Mm-hmm.
Not to mention the development of things like endometriosis and all these
Yeah.
gut issues and the thyroid issues and the autoimmune conditions. So the birth control pill is toxic to the gut microbiome, which is how you digest and absorb food. It
Mm-hmm.
can lead ultimately through that gut dysbiosis, lead to inflammation of your intestinal lining. And given that 80% of your immune system lives in the intestinal lining,
Yeah.
now you're going to develop immune dysregulation. That's where the persistent HPV problems come.
Mm.
These routine bacterial vaginosis things are coming up. The thyroid issues, all of these other autoimmune conditions, which I would throw endometriosis into the mix. You get all of that, but then also these substances are absorbed and pass through the liver. They bump up binding proteins that mess up other endocrine
Yeah.
organs, including your thyroid, but also a variety of other endocrine systems. And now, so you've left them with a propensity, let's say, not
Mm-hmm.
a guarantee, but a propensity for nutrient deficiencies,
Sure.
for it wreaks havoc on your metabolism. You've got all sorts of issues now within your hormonal feedback loops, and it's all because you wanted to get rid of that pesky period. Like, I
Yeah.
don't think we're doing a great job of counseling people on, hey, this is one way to not get pregnant.
Yeah.
But instead of putting them on these poisons, why don't we talk a little bit about fertility awareness,
Yeah.
and what it actually, like, what we can learn about the body when we're not on these toxic things.
Yeah.
And then if you still need it, we can still give it to you, but it should not be 20 million women a year or
Mm.
whatever it is that are being prescribed these things for every reason under the sun, from anxiety and depression to PMS to acne to,
Yeah. Well, it's
God
just
knows what the next indication will be.
blindly making choices. And also, somebody like Andrew Huberman, I agree. He's a great podcaster. He's got lots of great information. But like you said, I mean, he has such an impact on,
Yeah.
society at large that it can be dangerous when you're putting
Yeah.
information that you're not, like you said, you're not staying in your lane. You're giving information without knowing the full, what are, like, dive into it much deeper than that, so that
Right.
the people who are listening to you, the women who are listening to you, aren't going to be like, well, Andrew Huberman said it was good, so it must be good. I'm
I
going to,
hear it every day.
so
Yeah.
absolutely. And on that note, on the men's side, I think more and more men now are on TRT, so testosterone replacement therapy, growth hormone, I mean, anabolic steroids. It's
Yeah.
kind of,
Yeah.
I think for sure the TRT seems to just be like everywhere you look now. And so
Everywhere.
my question is, on the man's side, in terms of conception, using the bioidentical hormones. So first, why don't we start there? Is there like synthetic hormones versus bioidentical hormones? Is there difference between those two, whether it's for estrogen, progesterone, testosterone?
Yeah, so the bioidenticals tend to come from, let's say, like, from the urine of a pregnant horse, right? Like,
Mhm.
you're getting these hormones, they are biologically active, and there's no difference biologically between
Okay.
what's in this paste and what's in your body, sort of. I mean,
Okay.
like, I would have to kill you and extract every one of your hormones in your blood and then bottle it up and say, we can now give you hormones from
Got
a
you.
healthy woman, right?
Mhm.
So it's not that great, but it is way better. The bioidenticals, I mean, are way better than these otherwise synthetic. They're like pseudo hormones. They're not really hormones.
not
They
even
do hit the receptors that hormones hit, but they also wreak havoc elsewhere.
Mm.
So yeah, I'll stop there.
Okay. So then when it comes to a man using like testosterone replacement therapy, for example, my first question is, how does that affect him in terms of pros, cons in the conception, being able to impregnate a woman? A, and B, are those hormones that he's taking absorbed through the semen in a woman's vagina? Is that something
Oh,
that
good question.
the woman uptakes to potentially create an imbalance for her indirectly through him?
Yeah. I'd have to dig into that.
Yeah.
If it's a topical, there are certain like AndroGel is something that I use for some of my male
Uh-huh.
clients. They want a little boost in testosterone, but they don't want to inject. It's highly variable
Okay.
how much you have
Mhm.
to use, how frequent. And what sometimes people will say is you can smear it anywhere on your body, right?
Right.
But you can smear it right on your genitals as well.
Mm.
So if you were to do that and then have sex with your partner, absolutely,
Yeah.
they're getting androgens from your penis and your
Yeah.
testicles and wherever else you smeared it.
Yeah.
A lot of women this is a big beef I have right now in the functional medicine community.
Mm.
There's nothing functional about it. It's very dysfunctional. Is that a woman will go and say, my libido's off or whatever. And instead of asking about how their sleep and
Yeah.
what are their micronutrients like, I mean, how are they living their life? They just say, oh, let's do like $1,000 worth of labs. Your DHEA is low.
Mm.
Now we're going to pop you on androgen therapy, which is DHEA or testosterone or whatever.
Right.
And if it's and that messes a lot of women up for starters. That's like a bridge to getting your lifestyle back in order. I sometimes will utilize that, but if I give you the gel, because a lot of women don't want to be injecting themselves, and let's say you smear the gel on your breasts and your belly and you have a
Mhm.
newborn baby, that newborn baby can now also
Yeah.
get the androgen. So we have to be very thoughtful about that. But I mean, frankly, if you're putting exogenous hormones in and it is not absolutely necessary,
Mhm.
you're inevitably going to run into issues.
Okay.
Like inevitably, 100% of the time.
Right. So for you, using things for women specifically, getting a testosterone pellet put in her, or using cream, or the DHEA, all of these things are, I mean, I'm kind of in the space and I just kind of see these things more
Yeah.
exploding now, really, for women and for men. So what are
Yeah.
some of the side effects that a woman could experience by supplementing with testosterone, for example?
Yeah, I think probably the most common one that I see is they start developing skin blemishes and acne.
Mm.
It's like they're just like they've got too many roids in them, and
Yeah.
their body is expressing it and trying to like almost get rid of it. Is
Hmm.
kind of the way I'm seeing it happen. Certainly, if you are low in your androgens,
Hmm.
you can see changes to your libido, your motivation, and your energy levels and all of that. Like that is real. Like I'm not saying that isn't
Sure.
real, but the question for me is why is it low?
Yes.
And 9 times out of 10 it's because your hypothalamic pituitary adrenal axis is all out of whack,
Right.
meaning you're not resting enough, you're pushing yourself too hard in the gym, you're doing too much sauna, maybe even too much cold plunge or
Yeah.
cold immersion therapy. And it's so taxing to your nervous system and the adrenals and your catecholamine, like this whole
Yeah.
axis
Yes.
that your adrenals are just struggling to keep up.
Yeah.
So, first and foremost, if you're not sleeping 9 hours a night with your routers off, blue light
Yeah.
blockers before bed, you're not going to have that rise in melatonin and that drop in cortisol.
Yeah.
It's just not going to happen.
Hmm.
So we can supplement all day long. There's great sleep aids out there.
Yeah.
Bioptimizers makes one of my favorites.
Hmm.
However, that is not a replacement for getting your other
Yeah.
taking some of the stress off of your adrenals.
Yeah.
So back to your question, you're going to see an immediate benefit for the most part when you get on this.
Hmm.
The consequence though is that the cost of that short-term gain
Hmm.
is potentially further disruption in some of these hormonal feedback
Right.
loops that you're relying on to keep you alive.
Yes. Got
So
you.
I could riff on that for
Yeah.
hours, but
Well, I
I'll
mean,
stop.
I guess what you're saying really is, though, we go into these things sometimes treating the symptoms and not getting to the root cause of why those things
That's
are
right.
happening in the first place, right?
Yeah.
Yeah. So with the men, though, using other aids, like, for example, say growth hormone or like anabolic steroids, for example, that is, I have read in multiple different papers that especially with anabolics, those can really decrease a man's sperm count.
Oh,
Is
yeah.
that true? Yeah.
Yeah. So here's how that works. So the brain has to tell the testes to make sperm, a process called spermatogenesis,
Okay.
right? So it goes from a little twinkle in your eye to a little single cell that eventually grows a tail. And you need tens of thousands of these to be healthy, strong, with intact genetic material, which we can get into after. We need those to be able to surround this egg, form what's called a pre-attraction or preconception attraction complex, this like halo 3-dimensionally around the egg.
Okay.
And then at some point, cooperatively, one sperm, I think, is just
Yeah.
chosen. It's almost like their colleagues are there supporting them on. It's not like the strongest one won. That's the first big problem we have in this whole model of
Right.
fertility. But in order for you to have all of those sperm, this signal has to come to the brain, from the brain to the testes. And the testes, in response, make sperm, they make testosterone, they make some other things. And if you're artificially adding a whole bunch of testosterone to the system, and now the brain is detecting, hey, there's plenty of testosterone. We don't need to pump any more hormones down there to make sperm because they come together
Right.
within the testicles. The brain stops sending the signal to make sperm, and you're left with basically shutting down that whole axis, and you're sustained on this exogenous injection or paste or gel or whatever of testosterone. So what you will find almost always for a person who's been on TRT for a while is they've got tiny balls and they've got no healthy sperm, like almost completely gone.
Wow.
So there's ways around that. When people are on this, if they are, a lot of my jujitsu friends are on it because they get faster recovery in their late 30s and they want to keep up with these 22-year-old monsters. So they're taking the TRT, they're feeling good, their libido's great, they're feeling all the good things, very safe in the long run, apart from the fact that it shuts down your reproductive system.
Right. So you're
So you
basically
can
locked in for life.
Yeah. Not for life. I have had people come off and it slowly comes back, but it can take a long time to get back to baseline, like surprisingly long, because you've told the brain and the testes, you guys don't have to talk anymore.
Yeah.
It's like they're like estranged now and they have to start communicating again. So you can facilitate this, stay on TRT if you wish. You can facilitate this through things like human chorionic gonadotropin or something called clomiphene citrate, which kind of tricks the brain into making more of that stuff, and directly targeting the testes to make more sperm.
Okay. Yeah, I mean, I think maybe for older men and women, maybe they'll start implementing some hormone therapy, but more and more older are also trying to conceive. I think a lot of couples are now trying to conceive later in life. And so maybe they've been on birth control for the last, 25 years or something. And the man's been on TRT for, I don't know, 10 or 15, so it's something, I guess, prior to embarking on something like that, or knowing that you're going to want to have children, it's something to really, consider.
Yeah. I mean, and I mean, not to mention that if your entire goal right now is to get bigger, stronger, faster, like that's an energy requirement in the body. Why would your body be looking to make sperm and reproduce if you're telling it we're in a war at all times? So I mean, and that's not even metaphysical. It's very, very literally what happens in our energy systems, especially in women. If you're overstressed, your reproductive system shuts down because it's not a safe time to have a baby. Simply put, that's really what I work with people on.
Which is oftentimes women will just lose their period, right? If they become overstressed or they get too thin, they'll just basically, like, there's no better sign from the body saying, oh, well, we're just going to take away your period completely, right? So I used to do fitness competitions when I was in my, later 20s, and I just lost my period, and it took me like a good year of starting to incorporate more healthy eating again, and not being in these massive calorie deficits, where I finally was able to regain a period. But it was quite frightening to see that in my own body, that, wow, I've lost my cycle,
Right.
So
and
go ahead.
One last thing I'll say there is that, we make sperm every single day, but there's a life cycle. It's like I can't remember how long it is. I think it's around 60 days, but that means that however much time you as a woman experienced in regaining that regular predictable bleed,
Right.
we have to think about that for the men, and we have to add on the life cycle of sperm.
Right.
So you might be waiting 6 months until you can even start trying,
Yeah.
right? After you come off of this. So that's why I don't want anybody to feel bad about being on it. But if you are struggling with fertility, if this isn't your priority, like, you're not entitled to have kids. Like, we can't out
Exactly.
biohack the way you
Exactly.
live your life. It just isn't possible. This
Exactly.
is a very precious miracle that takes
Yeah,
place.
exactly. And I like that, what you just said. I mean, sometimes like you really have to, before you bring this life into the world, it's like you have your priorities. You can't be, Mr. Universe or Ms. Universe and, doing 2 times a day training splits and injecting and then expect to have a healthy pregnancy, conception. It's just not realistic by most standards. So,
Yeah.
the other thing too for creating healthy foundation, aside that are maybe some of the less obvious, is actually doing the emotional work prior as well. And
Yeah.
like, how have you or do you implement, for example, doing the inner child work? So prior to bringing a child into the world, to actually taking the time to heal the child within you, that so many people are walking around and they haven't taken the time. A lot of people don't even know what that means, but how that's going to affect not only the prep, because, obviously that's going to impact the relationship with your partner, but certainly after you have a child, if those wounds haven't even been looked at, I mean, that can
Yeah.
create like a spiral of, what your mother did to you or your father. So how do you approach that with your patients?
Yeah. So what I have every one of my clients do as soon as they get that glimmer in their eye
Mhm.
is I'll have them each write separately a mission statement.
Mm.
And I really want them to explore, what does this child mean to me?
Oh,
Like
yeah.
like what archetype do I embody now,
Mhm.
and what archetype am I going to embody as a father
Mm.
or a mother?
Yes.
And when you have them do this, I used to have them just do an archetypal exercise, and it didn't go deep enough for me. So I actually have them write a mission statement. Oftentimes the men write a couple sentences and the women write a volume.
Right. Yeah.
And right off the bat, I can tell that this might mean something very differently for one partner versus the
Right.
other. And so I think getting on the same page is the first step to conceiving consciously. I think people
Yeah.
hear this term, but it's not like a step-by-step manifesto you follow that you get from like the dark web. It's
Yes.
like, are you guys on the same page here? And then going back to your question about the inner child, what part of you feels unfulfilled, and you're trying to fill that up with a child? Because if that's the case, if I was
Yeah.
the spirit of baby, I'd be like, you're not ready for me, because I am not going to be able to make you heal. I
Yeah.
need you to be there. Like, I need you to be giving every bit of
Yes.
yourself to
Yes.
me. And that's what it requires to grow a baby. And especially for us dads, like, you're not just there to feed the baby when the mom's not around,
Yeah.
like your partner's not around. Like, your baby needs every bit of you, your presence, your time, your your humility.
Yeah.
And if you're going into this because it's just this next accessory you're
Yeah.
collecting in your life, it's not going to be an easy journey. And most importantly, you and your partner are going to fall, like,
Yeah.
you guys are going to become estranged in this whole thing. You've got
Yeah.
9 months to get ready, and then the baby comes, and now what? Now you have to take care of this baby?
Yeah.
Like, what? Like,
Yeah.
it's we
What, we
focus
can't
so
go
much
for
on.
Friday night dinner and drinks?
Yeah, yeah, exactly. We focus so much on sperm count and
Yeah,
motility
yeah, yeah.
and DNA fragmentation that we forget, like, guys, when you have this baby, you are not going to be spending 4 hours per day in the gym. Like,
Yeah.
I'm sorry, it's just not. You can do it. People make it work. You can have a nanny, you can have a
Yeah.
housekeeper, you can have all that. But did you have a kid for other people to raise your
Exactly.
child, or did you have a kid to have a kid?
Yeah.
Like, because this is something that is a very scary next stage of your adult development.
Yeah.
And when you start to reframe it like that, now it's like you got to put your big boy pants on
Yes.
and start really acting like an adult who doesn't have unlimited time to self-care every single day. Like,
Yeah.
this is a real test of being an adult,
Yeah.
I think, is can
Absolutely.
you keep a child alive and still keep your relationship and your intimacy intact? Like, that's where the real work comes in. And if you don't do that mission statement ahead of time, I think a lot of people are very disillusioned by what is to come for the next 18 years after the
Hmm.
baby's born.
Yeah. So, in your experience, then, when you propose those questions or have them write that down, do you find, I mean, maybe not so much. I would imagine that a lot of people are coming to you or already maybe embracing more of a holistic approach to things.
Yeah.
But
Yeah.
do you find that sometimes it's hard for both the man and for the woman to actually be able to verbalize or to put those thoughts into form, like to integrate and embody what they may be feeling inside so that they can kind of transcend that
Yeah.
and get beyond it, like their own woundings, for example, or their own traumas that they've had in their life?
Big time. Big time. I think women carry the burden not just of this fertility thing, but also the burden of growing the baby, giving birth and then keeping the
Yeah.
baby alive. Whereas us men, oftentimes, not to anybody's discredit, but I think we're kind of lost. Like, I don't
Yeah.
think we really
Yeah.
appreciate what our role is here. And a part of these exercises early on is not so much for me, it's actually for you guys to be speaking in a way that you maybe have never spoken to each other,
Mm.
to be like, as a man, to be fully vulnerable, that the idea of having to keep a little baby alive is terrifying. Like,
Yeah.
I need to hear you say that. Because if you aren't scared, if you're not
Yeah.
apprehensive, maybe, then you have no idea what's coming. You have
Yeah.
no idea how hard this is going to be.
Yeah.
I've done a lot of hard things, as have you, in your life. But like, I mean, what was the hardest thing you ever had to do? Like, apart from even birth, like, was
Yeah.
parenting hard for you?
Absolutely. Yeah, absolutely. Right. I mean, yes, times three,
Yeah.
so
Yeah, it's
it,
hard.
it's
It's really
hard.
hard.
And you have to step out of the ability, living in that selfish, I look after myself, self-care, like you just spoke about, and into creating the we. So stepping out of I into the we is, I think, one of the hardest things to do, and
Yeah.
if you haven't taken the time to uncover some of your own triggers and traumas and these types of things, then I think that the child can then be, they feel that. Children feel the energy and they feel everything. I'm sure that was one of the questions I was going to ask you, is like, when the woman becomes impregnated, the ability for the child to sense those things that haven't been, maybe discussed, and they haven't come to
Yeah.
light. And so maybe the woman's carrying around a fear that, oh, I don't know if my husband's going to be able to handle this, and putting the worry about how's he going to be able to, potentially show up for me and for this
Right.
child. And then the
Right.
child indirectly is also getting that energy as well.
Yeah. Yeah. When my wife and I, she had an IUD,
Mm,
and she pulled that, and she, by the way, would never go back on any sort of contraception,
yeah.
which is a separate conversation. I think she just felt like it really detached her from herself for
Yes.
so many years. And so she was happy to get rid of that thing.
Hmm.
And then we started trying. And when she told me, "Hey, I had, the IUD out and this and that," I don't think she felt that I was being very like present
Mm,
and like aware of the gravity of this.
right.
And so she had to stop me, and she had to actually have me say out loud, Shirley. It was very hard, believe it or not,
I
to
imagine.
say things are going to be very different,
Mm,
because I was spending, 40 hours a week working, 20 hours a week exercising, doing whatever
yeah.
whatever it is that we wanted to do,
Yeah.
going to Burning Man,
Yeah.
going out and doing drugs and getting high. And frankly, my response to her was like, well, I mean, a baby's just going to fit into our life. And she was like, honey, I need you to say it out loud, because I think that was a big fear
Wow.
for her. It's like,
Hmm.
bro, you've been attending births and you don't even realize just the gravity of what it is that we're about to do. Because
You.
I've never had to take care of the baby. That was even
Wow.
the pediatrician's job. So yeah, I think that a big source of stress. So every baby is going to feel what you're feeling,
Mm,
whether you vocalize it or not. But
yeah.
it really helps to process through a lot of traumatic things.
Yeah.
Do some real healing work before you get there, so
Hmm.
that you really know not only who you are, but where you want to go and what you stand for. And if you and your partner aren't on the same page, I think there's potentially some really rough roads ahead. And
Absolutely.
one final thing I'll say is, one of my clients recently, she gave birth and it was a totally fine birth, but her father passed away during the pregnancy, and
Wow.
she wasn't willing to grieve him because she didn't want to expose the baby to that.
Oh, wow.
And I was like, my friend, this baby is not listening with a headset, and you're like like earmuffs or
Yes,
something.
yes,
Like,
yeah,
this baby is feeling everything that you're feeling. And if you aren't processing that, you're going to leave this unprocessed and pass it on to her.
yeah,
And that is very real. Like, this is how I think sort of intergenerational trauma sort of
yes,
gets passed down. Like, the
yeah,
nervous system of the baby knows. They don't know what they're processing,
mhm,
but they know that there's some deep sadness here that hasn't been mourned
mhm,
and given its proper attention through the grief process. So
mhm.
yeah, there's a lot here that I didn't learn in medical school. I can tell you that.
Oh,
It's
yeah,
mostly just been listening to people and helping to figure out what does this
yeah.
individual couple need.
So on that note, so on my podcast, I've talked quite a bit about healing ancestral trauma and
Yeah.
how through the birthing process of choosing a holistic route to go through rather than going through the standard, Western hospitalized, situation. How can we use a birth as a way to heal some ancestral trauma that we may be carrying around through, like, who knows how long? I mean, if my mother
Yeah.
had a very traumatizing birth and her mother did, and it goes down the line, and oftentimes we're indoctrinated, most of us are, when we come in, we just think, well, we go to the doctor and we go to the hospital and we don't really think outside of those boxes. But how do you feel about the birthing experience as a portal
Yeah.
to heal ancestral trauma?
Yeah, that's a great question. The short answer is I really don't know how to put words to that,
Mm-hmm.
because it is a very, very sort of ineffable
Yeah,
aspect of the birth experience.
yeah,
What I will say is that the old version of you is dying and there's a new version of you being born. Very, very much a rebirthing process. And I will say that a lot of women who have given birth under my care, or that I've heard their stories, I've
mm-hmm.
just got on the phone, you had this traumatic thing happen, or it happened in the past and you had this beautiful home birth. Do you want to talk to me about it? And when you can start getting into the storytelling mode
Yeah,
and listening and really like having some reverence for this
mm,
process, I'm hearing that a lot of women are feeling that they've stepped into motherhood,
mm,
maybe after their fourth birth,
yeah,
that they finally feel like they reclaimed their identity. And
mm.
it's not that they're just a mother, it's the archetype of the
Yes, the
mother.
archetype. Mm-hmm.
And yeah, and they may have come from a long line of women who had C-sections,
Yeah,
and they're the first one. Maybe they had 3 C-sections and they finally had a vaginal birth,
yeah,
and it changes everything for them.
yes,
They can show up now in a very different way, feeling
yes,
empowered, probably in part because they decided for the first time in their life what was going to happen to them.
yeah,
And whether it's a good outcome or bad outcome is actually irrelevant.
yes,
When you reclaim your sovereignty by owning your decisions, by having a reverence for what true freedom and autonomy means, and then seeing yourself through the hellscape that can be childbirth,
yes,
and then you stand on your own 2 feet, I can't imagine anything that would be more healing and more empowering than that. And
absolutely.
that's what I'm hearing from so many women.
Yeah, I can. Yeah, absolutely. Just to be able to kind of the cliche saying of taking the power back, through that expression of just not following what's always been done and stepping into just a different version of that, of yourself. So I think that can be so transformative, and just looking at it through that lens too, of really feeling into, you know, into the ancestry, and how your mother and her mother and her mother, before that, the line goes down so long, and then being able to really really resonate into that and change that experience. I think that could be just so healing in and of itself.
Yeah, that's right.
Yeah. And I wanted to just also mention, so for those of you who have not listened to Nathan's podcast, episode number 72, on the
Oh, shit.
history of Western medicine, witches and healers, women healers, this is like, I listened to that and I was absolutely blown away by historically what has happened to women over the years, and what is it's continuing. I mean, you give some
Yeah.
amazing stats on what's still happening in the United States. I mean, we think, oh, this can't be going on in the United States, but it still is to this day, to a certain degree. And I think this can kind of come back around to the intellect versus intuition, and that we put so much and this can be within the masculine and the feminine as well, where the masculine may represent more of the intellect, the woman more of the intuition. And there's so much emphasis put on the intellect, and the intuition of the feminine is canceled out, thought to be, not worthy, judged, all of these things. And so there seems to be this war going on between these two camps. How do you see us getting out of that? Like, how, I know that this is a loaded question, but how do you see us as a collective being able to start moving more towards embracing the intuition and not believing that everything belongs to the intellect? And especially with women, like you talked about so beautifully in your podcast, just kind of canceled. It's like a canceled opinion or feeling.
Mm.
How do you see that potentially happening?
Well, for starters, I think that what we in the West, given our sort of materialistic lens of healthcare,
Mm-hmm.
for the most part, I
Mm-hmm.
mean, even people hear holistic, what they want is a prescription using a natural remedy.
Right.
Like, that's not holistic health.
Right.
Holistic health is considering what are the physical, mental, emotional, and even spiritual
Right.
aspects of what makes this person tick.
Mm-hmm.
And as long as we've married ourselves to that, what emerges is that we have a system that is bad because we don't have enough data, we don't have the better technologies, we don't have enough or easier access to pharmaceuticals.
Yeah.
And frankly, guys, our country has so much of that that I don't think throwing more is going to fix the problem.
Yeah.
Yes, like systems are great and having the ability to go to the hospital is great. But really, like in essence, it's a completely different value system when we look at healthcare through the lens of the materialist, reductive
Yeah.
lens that, people like Rene Descartes and Francis Bacon, like they were great at the time because they allowed us to dissect into bodies by arguing in a pretty compelling way that the soul and spirit and the mind are separate from this meat sack,
Right.
right? But on the other hand, if it's just a matter of understanding these individual car parts and putting them back together, we would live forever. And clearly that's not it. And clearly, actually, Cheryl Lee's experience is going to be if I asked you, how was your day? You're not going to say my appendix was working well and
Right.
my pancreas really put out a
Yeah.
lot of,
Right.
digestive enzymes. Like, no, Cheryl Lee's experience as a human
Yeah.
is going to be a lot of immeasurable sort of facets of who you are.
Yes.
So in order to fix this, I'm not so sure that I have a good response. That's probably like going to be the final book that I write in my life.
Yeah.
But I think we have to consider some of the great successes that we've had
Yes.
through mobilizing people against this medical, military, industrial complex. COVID had a silver lining, and it's that people realized, shit, not all the 3 and 4 letter organizations are necessarily looking out for my best interest.
Exactly.
We've also made had some great successes in identifying, like in our country, this might rattle people's cages, but in our country, we have a thread of systemic racism, even within our medical establishment, such that a rich, well-off, educated Black woman has similar birth or maternity statistics as a poor, disenfranchised white woman. There is absolutely no way around it. It's not just a matter of access to education or access to money or resources or distance to the hospital. It is actually inherent within our medical training that Black people are different from white people, and they end up being treated differently as a result. So, I know that's not what a lot of people want to talk about right now, but these are big issues in how women are being cared for. And then, of course, the last is the private and like the corporate interests and their involvement in politics is no different in medicine.
Yeah.
So we have a whole bunch of big players here, from social and racial to economic and political, that makes it very hard for me to visualize this system changing in any way.
Yes.
But if a person out there, the most disruptive thing I say that we can do is to make ourselves healthy enough that we make the system obsolete.
Right.
And then the politics, the racism
Yes.
that many Black women experience, all of this other stuff it all falls away because
Yeah.
they no longer have a consumer of healthcare if you don't need sick care.
Yeah.
And that's where the birth work community, like for me, I'm like, if you want to have a home birth with me, you're eating organ meats, you're
Yeah.
eating smoked oysters, we're getting your magnesium and some of your other labs, dialed
Yeah.
in. We're boosting your ferritin. We're getting your anemia resolved. We're going to get you healthy.
Yes.
And then you don't even need me. I'm there, but I'm just sitting in the corner waiting for a baby to come out. And then I
Yes.
say, good job, mama, you did it. And I walk away.
Yeah.
That's the most disruptive thing for me, as opposed to like the doctors suck and the system sucks. Guys, the system was built because you demanded it to be built that way.
Yeah.
You demanded quick fixes. You demanded people to give you the fast track,
Yes.
which we're seeing in the biohacking community.
Yeah.
We're seeing all of
Yes.
this happen again. So it comes down to, Shirley, the things that you and I hold near and dear.
Yeah.
Take care of yourself and your family.
Yes.
And let the
Yeah.
rest of that stuff figure itself out.
Yeah. Absolutely. Absolutely. So your one of your courses, the what is it? The
Bornfree
Born Free.
method?
You're Bornfree because you have two, Bornfree and then also Free
Yeah.
and Clear. So can you just do a little brief on what your Bornfree course is all about, what that entails?
Yeah, so it's actually I think you said 12 week. It's actually 12 months
Oh,
of
12
support.
months. Okay.
Yeah, and it's over 100 pre-recorded lessons on virtually everything I'm ever asked about
Okay.
getting pregnant, having a baby, postpartum. My co-creator, Sarah Rosser, is one of the farm midwives. She actually just resigned, but she got her whole career was at the farm in Tennessee, which, if those of you don't know, it's kind of this legacy. And a lady named Ina Mae Gaskin and
Wow.
some other midwives caravanned across the country and settled there and developed a midwifery program that to this day remains pretty famous, although it's starting to lose its traction because of certain things around COVID and other things that have been said. But so Sarah and I co-created the program, and it's really a resource so that if you have any question about anything from preconception all the way through postpartum, you're going to have a resource there to do that. And we meet weekly.
Wow. Okay.
So the whole group meets weekly. I bring in guest speakers. It is really the most comprehensive thing on the planet from the lens of a truly spiritual birth experience. We also hearken back to try to draw on as much wisdom that came through the traditional midwifery lens, which is not highlighted in episode 672 that you mentioned.
Yeah.
It's really an entire story of its own, where women have been trained by other women in their family through a lineage, and that's how they learned how to take care of women in childbirth. And that practice looks a lot like mine, but I had to learn it the hard way by investing money into my education and everything. So this is everything from vaccines to ultrasounds to prenatal vitamins to lifestyle modification. What's okay? What do the dads do? What's their responsibility? It is massive.
Okay.
But that's bornfreemethod.com if people want to learn more.
Wow, amazing. 2 more questions for you. How have you seen things disrupted after the procedure, if you know what I'm talking about? As of, I call it the procedure.
I can't imagine.
Yeah, what's the procedure? Because there's been a lot of talk about women because of that. All of a sudden, like I know there's countries in Europe that are seeing like the birth rates are down to almost like 0, and a lot of people are speculating, well, that's because of the procedure that was done and that's affecting their fertility. How do you feel about that?
Let me, before I answer that, I will answer that, but let me go back to, our fertility conversation around men and women.
Yeah.
Most women are carrying this burden. I would suspect that it's upwards. The stats will tell you it's 50% or whatever. I'm going to say it's upwards of 75% of the time.
Yeah.
Fertility challenges are due to the guy.
Okay.
And that could be not just the TRT guys, but, frankly, our sperm counts have been dropping nationally for years around the world.
Okay.
And there's a variety of things there. There's injectable things. There is EMF towers going up everywhere. We're not getting a lot of sleep. We've got junk in our air, water, soil. There's a lot of things there.
The list goes on.
Right. And our semen analyses would tell you that, hey, you're normal, but normal 50 years ago would not look nothing like 30 million sperm per cc. You need billions of sperm per the whole ejaculate. And so the semen analysis doesn't quite cut it. And then there's also the oxidative stress that leads to fragmentation of the DNA. And that means that you've got a sperm that's swimming, right? Like 1 cc is going to have, let's say, even 100 million. But if 100 million of those sperm, 50% have like kind of broken up DNA or genetic material, and they don't they go to meet the egg, and the egg's like, what the fuck, man?
Yeah.
You didn't bring your you didn't bring your stuff, right?
Yeah.
And so an embryo forms and then quickly, dissipates, and you have a miscarriage. So anyways, back to your question. I think that yes, there has been a decrease. Yes, it has done more harm probably than good.
Yeah.
And I think people love, again, this is reducing the entire experience down to prescription. If this supplement gets me this result,
Yeah.
then if it's that simple,
Yeah.
if your body is that simple, like a bunch of Legos, then it's very easy to say this thing caused this problem. I am not a dummy.
Yeah.
I am also not going to just throw it, any of my critical thinking away. And it is entirely irresponsible to say that this single thing, when we have a society where 60% of people are obese, and most people have some degree of pre-diabetes or diabetes, you're telling me that, oh, you've been like the picture of health, and now this thing is what caused this problem for you?
Yeah.
Like, get over yourself.
Yes.
And remember that this might be the straw that broke the camel's back,
Yep.
but this was not the beginning of our health issues.
Totally. Yeah.
We are already on the downtrend,
Yeah.
and I don't think that this has done us any good.
No,
Believe me.
for sure.
I am fully on your
For
page.
sure. Yeah.
But just say that this is the cause of all these dead babies, and like, give me a break, guys. Like,
you have
unless you're go ahead.
Well, no, I was just going to say, I mean, it comes back to taking responsibility for your health, which we talked about at the beginning, like sometimes people are just looking for a reason, an excuse to not take responsibility, to project it onto something else rather than having to do the work themselves.
Victim.
Yeah.
Yeah.
I mean,
victimhood.
Exactly.
Yeah.
So totally. I'm on the same page with you. So I have a question I ask all my guests at the end of our interview. So I'm going to ask it to you now. And the question is, what is your authentic life print? What is your unique expression as Dr. Nathan Riley?
My unique expression. Wow. Tell me, what does the life print? What does that mean?
What is your authentic life print? What is authentic to you as Nathan Riley? What is your unique expression? Because there's no other Nathan Riley that exists or will ever exist in this universe.
It absolutely has to be that I do what I want.
Okay. I love that.
I have neck tattoos. I have, I spend my time however I want. I have great sex with my wife. My little girls are tremendously gifted in all of the ways. And I have never, ever been willing to compromise who I am and taking responsibility for how I show up. So that has led to all of those things that I listed. And at the end of the day, I can say that I do things based on what I know works for me and my clients and my family. And I really don't care who out there, whether they have 4 master's degrees or whatever else, they're the president of whatever. It doesn't matter what they say because they don't know me, they don't know my story, and they don't know what I'm here to do. So
wow, beautiful.
I guess that's my answer. I've never been asked that before.
I love that. It's one of those questions that put you on the spot, but
I love it. Yeah,
for sure.
I'm like a little squirmy over here.
Well, thank you so much. I know where can people find you if they want to find more about your courses or contact you? How do they do that?
Yeah, clearhpv.com is the Clear and Free program. That's the deep dive into vaccines, immune health, cervical dysplasia, HPV, all of the things. A lot of women's health issues would fall into that program. That's clearhpv.com. Bornfree Method is the program we were talking about. We have open enrollment for both. You apply to enroll, and we get on the call and we get you in. And then my practice is belovedholistics.com, which is a landing page for most things, although Nathan Riley OB-GYN on Instagram is probably how most people find me.
Okay.
Honestly.
And
you can start there.
Yeah. And I'll put the links for everything below for sure. So thank you so much for coming on today. This has been such a beautiful, amazing conversation. And the first one I've had about holistic birth and all of the things that we've talked about. So I really appreciate your time.
My pleasure, Shirley. Thank you.
Okay. Thank you so much.